Washing my hands, and I am applying gloves. Right. Hello, my name's Mary. I'm a family nurse practitioner at the clinic. What is your name?
Will.
Alrighty. Will's come in today for a physical assessment. And I was looking over your chart. Your vitals are looking okay. Right now, at my first assessment, you are well appearing male. I'm not seeing any deviation or droop, facial droop, or any tremors or abnormal movements. Do you have any concerns that I need to be aware of? Okay, great. So a neurological assessment that we're going to be performing today is going to be comprehensive. We're going to be looking at your cranial nerves, your sensories. We're going to check your senses. We're going to check your reflexes and also check your coordination. So we're going to start first with your cranial nerves at the top. And what we're going to do first is I'm going to check to see the patency of your nares. If you could please press on your left nair and take a deep breath. Your left nair.
Nostril.
Yes. All right. Take a deep breath in. Out. All right. Switch sides. All right. All right. I have two scents here. I want you to close your eyes and identify them.
Peppermint.
All right. This is our emotional support dog at the clinic. All right, take a deep breath.
Lavender.
All right, you identified both smells correctly. I'm going to have you stand over here, and we're going to be checking your vision now. This is cranial nerve number 2, or our optic nerve. So if you come over here 6 feet away. All right, which line can you read the lowest of? Just if you just want to start reading.
LTFPH.
All right, so I'm going to have you cover your left eye. All right, what's the lowest line you can read?
GFDMJ.
All right, switch eyes. Okay.
Same line but different letters. GFDHJ.
All right. Yes, and you said the same letters as last time. So your vision is 20/25 by 20/21 combined. What color do you see here?
Red.
All right, and this color?
Green.
Great. So you've completed the Rosenbaum test. Moving on to the next portion, I'm going to have you grab a seat real quick. And we're going to check your optic condyle. So with this exam, set on the medium setting. And then I'm going to actually have you turn a little bit towards me for this exam. All right. And just look right over my right ear. Look towards look at my right ear. My left ear, I'm sorry. I got that completely wrong. All right. So I'm going to go ahead and have you. Alright, I was able to visualize the disc in the left eye. It is clear and the disc ratio is 1:3. I didn't see any druses or cotton bodies, and I did not notice any edema on any of the vessels. Alright, I'm going to have you look at my right ear. We're going to do the same thing. Okay. Do you need a moment?
Okay.
All right, you all right? All right. So we have a red reaction. And are you doing okay with that eye, or is it? So right now, we're just going to walk through what we do for the correct form of this exam, because he's been very patient with us this evening as we've been practicing, but we would be looking again at the vessels to make sure that there is no edema present, and also doing the and also looking to make sure there's no cotton bodies or any and also checking the disc ratio. All right, I'm going to go ahead and turn back on the light. All right, do you need a moment to adjust? All right. You all right? So I'm just going to have you look ahead at me. All right. His pupils are about 3 to 4 millimeters, and they are at light accommodating. I'm going to check your peripheral vision. If you could cover your right eye. All right. And I'm going to wiggle my fingers in the peripheral vision, and when you see it, just say yes. All right. Are you good with that?
Yes.
All right. Here we go.
Yes. 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 Yes.
Okay. All right. And switch eyes. I hope that's a little bit better on your eyes.
Sure.
All right. So again, keeping your eyes on me. All right. Here we go.
Yes. 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 Yes.
All right. So he was able to do that appropriately. Now I'm going to have you follow my fingers real quick without moving your head. Just use your eyes. Alrighty. He was able to track correctly, and his eyes did go down the way we wanted. Did go to accommodate to being closer. All right, moving on. We've done the cranial nerve 1, cranial nerve 2, and also looked at the size shape of the pupil. His pupils were round. His conjunctiva is a little bit pink right now because he's been very patient with our neurological exams this evening. However, they were intact. All right, moving on, we're going to check the cranial nerve number 5, which is a trigeminal nerve. And with this one, I'm going to put my hand real quickly on here, and I just want along his trigeminal nerve, and go ahead and close your mouth. Open your mouth and close it. Alrighty, and move your jaw, open your mouth. Move your jaw towards me and away from me. All right, up and down one more time. All right, now squeeze your face like you just had a lemon. All right, great. So symmetrical movements. Any pain in any of those areas?
No.
There was no abnormal findings, no crepitus noticed, or clicking in the jaw. So far, so good with those findings. Moving on to the next portion, we're going to be checking sensory. I'm getting myself a cotton swab to do so. And I'm just going to give you a test to sort of understand what you're going to be feeling for. So this is a sensation that you should feel. I'm going to touch different areas of your face and just say yes when you feel it, okay? All right.
Yes. 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 Yes.
All right. So that is an intact finding. There was no abnormalities there. All right. So the corneal reflex is a test we would do where we would take a cotton swab and touch the cornea to see if a reaction happens in both eyes. We are not doing it for this evening. However, this is a test that we do with a comatose patient. We would find they might not respond, someone that is in a vegetative state. Moving on to the next portion of the test, we are going to do the cranial nerve number 7, which is our facial nerve. So I want you to smile at me like a clown. And can you smile with your teeth? All right, frown at me oh, it's so sad. Blow your face out like you're a puffer fish. Go, All right, there we go. So all sensations were symmetrical on both sides. No deviation, droops, or tics happened with this performance of this one. Moving on to the, we're going to be checking the glossopharyngeal nerve and also the hypoglossal nerve. Let me move this up just a little bit. We're just adjusting, filming. All right. First thing we're going to do is I'm going to use my pen light and I'm going to visualize soft palate. I want you to say ah.
What?
Oh, sorry. So I was explaining to the camera, but what I'm gonna do is have you open your mouth and stick out your tongue. Alrighty, that looks good there. Now I'm gonna check your gag reflex. Okay, so I'm just gonna push this in just gently. Okay. There we go. Good response with that. All right, now open your mouth, and I want you to press your tongue to the right, to the left. All right, to the left. All right, sorry. Press down. All right, press up. There you go, perfect. All right, so all tongue strength was equal, movements were symmetrical, and tongue was symmetrical. There's no abnormal findings with either of these cranial nerves. Now we're going to move on to cranial nerve number 11. I'm going to put my hands on your shoulders and just shrug up against them. All right, press down, both symmetrical movements in both shoulders noted. Now we're going to move on to the coordination portion of this exam. I'm going to have you take your hands and we're going to make an adjustment real quickly for better visualization. Alrighty. Oops, hold on real quick. All right, can you bring your chair facing this way, please? Thank you. All right, so I'm going to take your hand. I'm going to take your hands and you're going to go put them on your thighs and now flip them over rapidly. All right, just able to do so correctly. All right, good and stop. All right, now I'm going to have you press against press left, right with your feet. I'm glad you understood that. All right, perfect. So those are both coordination appropriate. Now we're going to move over to I want you to touch your fingers to your nose rapidly. All right, his coordination is good. He's hitting his nose. He was able to tap his foot left, right, and also do the rapid hand movement. All right, I'm gonna have you stand up real quickly. And that this way. All right, well, this is going to be we're gonna be doing the Romberg test. And with the Romberg test, what you're gonna do is, I guess right back here. With the Romberg test, I'm going to have you put your arms out like this with your palms up, and I'm going to have you put your feet together and close your eyes for about 20 to 30 seconds. I'll tell you when to stop, and I'm going to press against your arms, just a heads up, so try not to lose your balance. All right, good findings with that. Go ahead and you can put down your hands. Now I'm going to have you walk across the room with your normal gait. All right, now walk back on your tippy toes. All right, and go ahead and reverse. And so I'm going to pause here real quickly. Walk on your heels backwards like a duck.
Backwards.
Walk on your heels backwards toward the walls on your heels. Hold on, let me be here. I can demonstrate. So you're going to go on your heels. You're just going to
walk on my heels.
Yes.
Not backwards.
All right. He was able to perform this and come back. All righty. So normal findings, he was able to walk on his heels and walk on his tippy toes, did not lose balance. All righty. All right. And during his walking, I was also observing is there any tics? Is there any abnormal movements or even Parkinsonian gait? I did not notice any rigidity or anything suggesting there would be further neurological workup needed. Moving on to the next section is going to be looking at muscle symmetry and also checking muscle strength. So what I'm going to have you do, hold on real quick. This might work. There we go. All right, so I'm going to have you bend your elbow. I want you to press against the hand on your arm. There you go. Now press away. Great. All right, I'm going to go over to this side. Press towards yourself. All right, now press away. Good. All right, so I want you to press against my hand, press up against my hand, press down against my hand, press up against my hand. All right, press down against my hand. All right, squeeze your hands into fist. All right, great. All right, so go ahead and relax your hands. So his arms are intact so far with muscle strengths. They're both equal bilaterally. All right, bring your legs together. Press against my hands. All right, press against my hands. We just checked his hips. They were both symmetrical in strength. There's no noted deviation from that. All right, press against my hand. All right, press against my hand. All right, lift up your leg, press down. There you go. There we go. All right, so going on down to his shins, press against my hand. All right, press against my hand. All right, now pull away. All right, one more time, pull away. Now with your feet, I want you to press against my hands. All right, now press up against my hands. All right, great. So strength is intact throughout. I'm not noticing any deviations on this portion of the assessment. All right, now we're going to move on to sensations and checking the sensory with touch and pain. So I'm going to go ahead and grab my Q-tip again. All right, so I'm going to be touching you throughout your body. I'm going to slide up your pants leg real quick before we perform this test. Thank you. Great. And I'm going to have you, we're going to have two sensations. It'll be soft and sharp. So this is what soft feels like, and this is what sharp feels like. All right, go ahead and close your eyes.
Soft, soft, sharp, 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 soft, 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 sharp, 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 soft, soft, soft,
All right, moving down here.
soft, soft, sharp, 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 soft, 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 sharp, sharp, sharp.
Alrighty, they're all intact. There was no deviations found on this portion of the exam. All right, I'm gonna have you flip your hands over, and I'm going to draw two numbers, a number in each palm. You just tell me what number that is. Go ahead and close your eyes.
6,
Yeah.
1,
Yep.
0, 5,
It's supposed to make, but so it was close. That's something we would monitor for. If you notice, do you have any tingling or any numbness in your hands?
not right now.
Okay, right. So is this something you've experienced before?
Yes.
All right. Is this something you're working with your providers on?
No.
All right. This is something you might want to bring up to your providers to make them aware to see if they want to do anything further testing wise. All right. So just making sure that we are taking care of the patient and anything that we find on this exam. Alrighty, now we're going to move on to a couple of the specialty tests. First one is I did check, so the first thing is it's going to be proprioception. If I could just see your feet real quick, and I'm going to try moving this here so that way y'all can visualize. So with proprioception, we're going to check that in the great toes. So tell me if you're moving up, if your toes moving up or down.
Up, down, up, up, down,
All right, moving to the other foot.
up, up, down, down.
All right, so both are responding appropriately. All right, moving on. Next portion, oops, sorry, knocked something over. All right, now we're gonna move on to hold on real quickly. I realize we are missing a section of it, and this is the deep tendon reflexes. Can you please bend your elbow for me? All right. Oh, sorry. All right, there we go. See this one? All right. Yeah. All right, lift up this arm. Moving to this arm. All right. There we go. All right, moving on to your legs. All right. There we go. This leg. There we go. There we go. All right, so those are intact.